it's CJ. Welcome to week 31 of your pregnancy. Today I'm going to talk about what's happening with your tiny human, some of the more common symptoms that you might be having. And if you stick around, I will tell you why you are having lower back pain and 10 simple steps that you can take that might help alleviate it. At 31 weeks, depending on what app you're looking at, your baby is now about the same size as either a pineapple or a coconut. Measuring 16.5 inches, that's just under 42 centimeters from the top of their head to the bottom of their feet, and weighs somewhere between 3.25 and 4.3 pounds, which is right around 1,470 to 1,960 grams. If you are carrying twins, your babies are slightly smaller, weighing right around 3 pounds or 1.5 kilos each, and measuring right around 16 inches or 41 centimeters in length. In the 31st week of pregnancy, your baby's brain is developing quite rapidly. He or she can now recognize both you as well as your partner's voice. Your little one now has distinct sleep-wake cycles, and the heart is beating about 110 to 160 times per minute. Here's some really good news. If you were to deliver this week and have access to excellent neonatal care, although yes, your baby will spend time in the neonatal intensive care unit, studies show that your baby now has up to 100% chance to survive. So here are some of the more common symptoms that you can expect in the 31st week of your pregnancy. Number 1, your fundal height. The top of your uterus is now measuring between 29 and 33 centimeters from the top of your pubic bone. If you are carrying more than one baby, most likely your provider will not measure a fundal height. Rather, they'll do an ultrasound to make sure your babies are growing appropriately. Number 2, frequent Braxton Hicks contractions, which can be caused by dehydration, a full bladder, if you've recently had intercourse, or if you've been too active. So if you are having 5 or more cramps in an hour, here's what I recommend. Empty your bladder, get off of your feet. Drink 32 ounces or a liter of water and monitor. If those contractions do not go away, please call your OB provider right away. Number 3, you may or may not be leaking colostrum from your breasts. Both are perfectly normal. And while it is okay for you to start collecting that colostrum, it's really too soon for you to start pumping your breasts or expressing breast milk. Number 4, frequent urination. After all, you have a 3 to 4 pound baby sitting on top of your bladder. And while frequent urination is perfectly normal, if you are running a fever, if your urine has a foul odor or is cloudy in color, that might indicate a urinary tract infection and you need to contact your OB provider. And finally, number 5, lower back pain. In the 3rd trimester of pregnancy, your placenta is now creating a lot of the hormone called relaxin. The job of the relaxin is to soften up this piece of cartilage so that your uterus can expand and a baby can come through when it's time to give birth. Unfortunately, relaxin also makes your SI, your sacroiliac joints, unstable. That, along with the change in posture and pregnancy weight gain, can cause you to have a lot of discomfort in your lower back. So here are 10 steps that you can take that might help alleviate that discomfort. Number 1, stretching exercises. Get on your hands and knees and arch your back like a mad cat. Try to get that baby off of that lower back. Number 2, use a heating pad, set on low. Number 3, try taking a nice warm shower, or better yet, a warm bath with Epsom salts before you go to bed. Number 4, a massage. Number 5, try wearing low-soled, comfortable shoes. Number 6, a pregnancy support belt. Number 7, try to avoid heavy lifting, which I know can be really hard, especially if you have a toddler in the home. Number 8, engage in low-impact exercise, such as swimming, on a regular basis. Number 9, consider either physical therapy or chiropractic care. And number 10, if all else fails, talk to your OB provider about medication that you can take that is safe to use in pregnancy. I do hope that this information has been helpful, and that if you have any questions, you'll let me know in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button, or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.